Evangelisabal from BSN2B, and for today I will be doing the perineal care procedure. Now the purpose of this procedure is to not only clean the perineal area but also to check any infections and lesions within that area. And then following the nursing process, first I will do an assessment of my client. So I will be checking my client's condition before doing or starting the procedure. So, good day ma'am. May I check po your perineal area po? Okay, thank you po. So, everything seems to be normal. So, there are no underlying infections or lesions or swelling. And then after that, I will now plan and prepare the equipments I will be needing. So, I will need a towel or towels, washcloth, bucket with warm water, a soap, glove, and waterproof pad. And then also I will proceed to the implementation in which I will check the physician's order for any precautionary measures before doing or starting the procedure. So let me just check. So according in here, there are no any extra or precautionary measures to be reminded. And then after that, I will now proceed to the performance of the perineal care. So first, I will identify my patient and introduce myself to the patient, explain what am I going to do, why is it necessary, and how the client can cooperate. So good day ma'am, I'm Principal, your student nurse for today. May I know your name? Okay po, may I know your age po? Okay ma'am, thank you. For today po, I will be cleaning your perineal area po to provide you more comfort and to get rid of any bacteria, also to check if there are any infections or lesions or swellings within that area. Would that be okay with you, ma'am? Okay, let me just check it again. So you already signed a written consent, ma'am, right? Okay, thank you, ma'am. So during the procedure, I want you to lie still. Also, notify me when you are feeling uncomfortable and you are feeling any untoward reaction. Would that be okay? Okay, ma'am, thank you. And then after that, I will now provide hand hygiene, or I will now perform hand hygiene and observe other infection control procedure. And then also, I'm going to provide privacy for my clients, so I will close the curtains around the bed and the door to the room. Also, I will be providing an adequate lighting for me to have a clear visualization of the field when doing the perineal care. After that, I will now place the bed at an appropriate and comfortable working height. And then I will put on gloves. Now that I'm done, I will now place the waterproof pad under my patient by turning my patient sidewards appropriately with the knees flexed. So ma'am, I will just put this under you and let me just turn you sidewards. I will now expose the perineal area by making a little window. And then I will now get the bath mitt and put it on the warm water, and then I will put some soap in it. So we will make a bath mitt. Then I will use my non-dominant hand to separate the labia. And then I will clean the perineal area with the three areas of the bath mitt in the two sides and the middle. So I will start on the farthest side of the perineal area. So one stroke from front to back. So front to back and down. Then the other side, front to back and down. And then to the middle, front to back and then down. Then I will be placing this bath mitt on the laundry hamper. And then I will get another bath mitt to rinse the perineal area. Other side, front to back, the other side, front to back, and then. And then now I will pat it dry. And then after that, I will now cover my patient and turn the patient sideways to wash the bath area. So we will expose the bath area. Then I will get another bath mitt. And put some soap. Then I will start on the middle, front to back, and then to the other sides. Then I will place this in a laundry hamper, and then I will rinse it using another bath mitt. So in the middle, front to back, and then the other side, then the other side. Okay. Then I will also pat it dry. Then after that, I will now be removing my gloves, and I will avoid to contaminate my hand. Place it and proper disposal. And then I will now cover my patient. Very comfortable, ma'am. Very good. And then after that, I will now remove the waterproof pad under my climate. After that, I will position my patient in a comfortable position. So, ma'am, are you comfortable? That's good. Do you need anything? Okay, thank you, ma'am. And then, I will now place the bed on its normal height. And then, I will now do a proper hand hygiene. And I will be replacing the equipment, all the supplies I used on the storage area. Now, for the evaluation, we should document the assessment done, and then also document and report any significant findings that deviate from normal to a primary care provider, and lastly, reassess the patient and check for any discomfort or problems after doing the procedure. So, ma'am, are you comfortable enough? So, are there any discomfort or problems? Okay, thank you. So, that's all for the perineal care procedure. Thank you. For an additional information, if you're going to do a perineal care for male, this is how we do it. So first, we need also to get a bath mitt with the warm water and soap. So assuming this is already soaked with the warm water and soap, and then we will start at the tip of the penis in a circular motion. And then, for the other side of the bath mitt, the shaft and down. And then the other side, shaft and down. And then the other side, the scrotum. And then you will just rinse it just like that and then pat it dry.